I found the lump.
Sandy Seguido, an avid biker, was on vacation in Miami, Florida when she found a lump in her right breast.
I mean, I could feel it. It was there.
A diagnosis of breast cancer crushed Seguido and left her in denial.
I have no family history. I have no risk factors.
Fear gave way to hope when Seguido learned her surgeon would be wearing special eyewear during her operation.
It's like, wow, we have Superman glasses.
The Superman glasses, known simply as cancer goggles, work with an infrared light that help doctors see cancer when a patient's malignant tumors are injected with a dye, which makes them glow.
What the goggles are really doing is they're helping me see the fluorescence that we've marked or tagged to a specific marker that is taken up by the cancer cells.
Dr. Julie Margentaler was the first surgeon to use the space-age device on a breast cancer patient to determine whether it works. It does.
I can see things very clearly.
When Margentaler wore the goggles during Seguido's procedure, she wanted to know if they could identify margins around tumors and lymph nodes,
which ultimately did confirm some microscopic tumor extension at those edges. So that was very exciting to us that we were able to see down to that level of detail. We would not have been able to see that without the goggles.
The cutting-edge eyewear has been used successfully in the fight against other cancer, too. Dr. Ryan Fields used the glasses during surgery on a patient with skin cancer.
It's an incredible piece of technology that I think has a lot of opportunity to really improve on what we do in the operating room.
It's light.
Dr. Samuel Achilefu, a professor of radiology at Washington University, invented the cancer goggles.
This is the new see-through goggle device.
They are much smaller and lighter now than the heavy, clunky design originally created.
It should be simple. It should be easy. It should have low learning curve such that we do not need to retrain the surgeons on what they already know how to do.
The goal, Dr. Achilefu says, is to use the space-age technology for all types of solid cancer and remove all of it during one procedure, giving patients peace of mind.
The welfare of the patient is critical. Do they live in fear after surgery that they may be coming back? Do they live in fear that there may be residual tumors? Do they live in fear that it may relapse the next day? Those are all uncertainties that most cancer patients face today.
Dr. Achilefu is being showered with recognition for his groundbreaking technology. He was recently honored with an endowed professorship at Washington University, the highest honor bestowed on a faculty member for his work.
I think it's a pretty phenomenal deal, which is why I keep saying Sam is a rock star.
Colleagues like Dr. Tim Eberlein, director of the Siteman Cancer Center, hold Dr. Achilefu in high esteem and couldn't be more proud of him.
This is not work. This is not a job. This is a passion. And he does this because he has a passion for wanting to improve health.
Sandy Seguido, a neurosurgery nurse, is grateful for that and for the cancer goggles that led to her being breast cancer free.
As a patient, I think it's wonderful.